Assalamu alaikum. Welcome to this episode of Second Home. Today we cover the best of Indian Healthcare Expo 2019 here at Radisson Blu. It is showcasing India's best hospitals in Kuwait. So stay tuned to find out more. A high-profile medical services exhibition titled Best of Indian Healthcare Expo 2019 organized by the Embassy of India in Kuwait in association with the Indian Doctors Forum (IDF), Kuwait Medical Association (KMA), Indian Business and Professional Council (IBPC), and Confederation of Indian Industry (CII) at the Radisson Blu. Participation from more than 20 exhibitors, including the Indian hospitals and healthcare centers, alternative healthcare providers, wellness centers, and prominent medical package planners from several cities in India.
I thought as Ambassador of India, we already know that India-Kuwait relations are very strong, deep-rooted. They are people-centric, people-oriented, people-to-people, cultural affinities, historical. So I can use this human dimension to build the relationship and make it even stronger. So that is the motivation that let me use the presence of huge Indian doctor community in Kuwait and introduce what India can offer in the context of that human dimension that can build our relations, even make them even stronger. I would say one more thing about what Indian healthcare sector is. We have experts here. They would speak to you more in detail. We have a keynote speaker who has come from India. But about the Indian healthcare sector, I would only mention about one strong point from a patient's point of view. For instance, if a Kuwaiti friend or a foreign friend living in Kuwait, they are looking at medical care, health care, this would be, in my view, very, very important, very critical. And I'm saying this very dispassionately, without any bias. An Indian doctor, probably you can beat him in everything else, but not in his diagnosis. If every medical doctor will tell you, if the diagnosis is right, then your treatment will be, it's automatic, it will follow. But if you make a mistake in the diagnosis, then you are going the wrong direction. And I can assure you, I can tell you with great assurance, with great conviction, and I'm not saying this because I'm an Indian ambassador, but it's from my heart, and I have seen this from Indian doctors because of their experience, because they would have seen almost every ailment in its nuances. For instance, take a heart stroke. A simple heart stroke may have several factors behind it. And an Indian doctor, for instance, by seeing the patient, asking a few basic questions, he would tell you exactly what has caused that stroke. And that is one unique aspect of Indian medical profession. And because of their experience, because of the number of patients and almost every aspect of the disease that they would have seen, that is the reason. So by bringing this healthcare expo to Kuwait, our interest, the embassy's interest, is to use this dimension as a further bridge to strengthen our bilateral relations, which are already strong.
It's now time to have a quick chat with Dr. Nayak, who is a histologist by profession, but he also wears the hat of the president of the Indian Doctors Forum here in Kuwait. Tell us about IDF's involvement in this huge mega event here.
IDF has been actively involved in this event with the Indian Embassy and IBPC. Indian Embassy had a plan to organize this event, and we thought it's a medical event and IDF has to be there in this event. That was how it began, and we told His Excellency Ambassador, we are willing to help you in any way, whatever way we can. That was the idea, and that's how it began.
And I believe you played an important role in connecting to all the hospitals in India?
Yes, of course. We helped individually and through all our doctors, reaching out to different hospitals in various cities of India. That's how we could gather around 20 hospitals today for this event. It's a great success, I believe. It's a beginning of the expo. So in year after year, we are planning that more and more number of hospitals will participate. It's our belief.
And obviously showcasing our hospitals here in Kuwait helps, because there is awareness that is created. People who are looking for these kind of medical services finally now know where to go.
Yes, they know by visiting these stalls. They know India is one of the best medical location to visit, with the state of the art facilities with the affordable rate. That's how India will be I think it's a future attractive center. All over the world, people are traveling to India for medical tourism. Already it's catching up.
Our keynote speaker, I'm very impressed with his credentials, Dr. Reddy. Tell us more about him and why you chose him to be the keynote speaker for today.
Yeah, Professor Reddy is a suitable keynote speaker for today. He is from cardiologist from AIMS, Delhi, and he has a degree from McMaster's in epidemiology, and he has come today to give the keynote address here in Kuwait. And we are fortunate to have him here because he has the highest award from the country. That's a Padma Bhushan award presented by the president to him, to his credit. And he has more than 500 publications. He has more than so many honorary doctorates. And he is an amazing, great personality to have him here for this keynote address.
Really looking forward to his notes about this event as well. And if there's anything now you'd like to tell your audience, the stage is yours.
It's a nice opportunity for all to visit all the centers and get to know about the facilities available. It's a great opportunity, I feel. Thank you.
Thank you. Thank you for organizing this. Thank you. It's now time to talk to Dr. Waleed Al-Harbi, the medical team leader at KNPC. Welcome to our show.
Thank you for interviewing me and giving me this opportunity to come to this exhibition.
Could you tell us your views about today's event?
Well, it's a good opportunity to explore more about the Indian doctors and Indian hospitals. And I was surprised, almost all the surgeries and the procedures, the specialties, what we usually see in Europe and America, it is available in India. And I came to know when I went through across some of the medical centers here that even the prices is much less than what is happening in the Europe and the United States, and with a good quality and end results. So this is good opportunity for us as Kuwaitis and medical professions to know about about India and what they have there in India.
So this event has succeeded in its mission about raising awareness.
Yes, actually it's as I said, it's a good exhibition to tell us more about India, to explore more about the healthcare services in India, and there is an add value for us as a health professions. Even we can give advice to the normal patients where to go. Some patients, they want to go under their own budget, so they can afford whatever medical treatment needed and whatever surgeries. So well done to the Indian Embassy for preparation of such exhibition.
you so much for talking to us. We'd also like to know a little bit more about your regular day at work. How does it look like?
I'm the head of the medical division in Kuwait National Petroleum Company, and I'm responsible for the healthcare services provided for the employees of KNBC, Kuwait National Petroleum Company, and we have like emergency services, primary healthcare services, and occupational health services. And actually, I'm the consultant for the management and for the employees. So they usually ask me, take my advice, even if they want to try some of the health services in Kuwait or outside Kuwait. So basically, this is my daily work.
Thank you so much for talking to us.
Thank you for giving me this opportunity for this interview.
I am very pleased to bring to you Mohandas Muhammad Al Khulefi from the Life Science Academy. Welcome to our show.
Thank you very much. Thank you.
Mohandas, could you tell us about your opinion of today's event here?
Very good. Thank you so much for this opportunity. I believe this opportunity is an excellent opportunity to exchange the knowledge and expertise between different nations, India and Kuwait, specifically in the healthcare industry. So I believe it's a great opportunity to meet such exhibitors and to know how we can collaborate and how we can improve the healthcare industry, especially the patients. It's all about the patients, focusing on the patients. And I believe India has progressed very well. And today we have witnessed through the ambassador's speech that India is really on the top of its fields in terms of healthcare specialty, and it's the right time now to find opportunities to collaborate with Indian patients and with the Indian hospitals, and to see their expertise and experience in such arena. And I believe now, through going through these exhibitions, it's a tremendous, valuable opportunity for us to learn from them as well.
I believe there are like around 20 hospitals, which is a huge event here today.
That's true, and they are the elite in India, and we look forward to find the right opportunity to collaborate with them. And we are really keen to also invite everyone here in Kuwait, whether they are private or public hospitals, to find during these 2 days the right opportunity as well to collaborate with those exhibitors.
You are from the Life Science Academy. We'd love to hear from you about its aim for 2019.
Life Science Academy is owned by the National Technology Enterprise Company, which is fully owned by Kuwait Investment Authority. And the aim of Life Science Academy as the first healthcare academy in Kuwait and in the Gulf region is to develop the practitioners, whether they are doctors, nurses, pharmacists, and to give them the opportunity as an access to the top and elite institutions in healthcare, and to transfer the knowledge, the curriculum that they have, as well as the best trainers and instructors from all around the world.
Our wishes are with you from the Kuwait TV team. We wish you every success in all your endeavors. May Allah be with you.
Thank you very much. Thank you. All the best. Thank you.
And it's now time to talk to Dr. Vivek Jogani, who is a preventive and pediatric dentist. Welcome to our show.
Thank you, Amina. Thank you so much.
Doctor, I was very fascinated with your smile on that jacket. Yes, tell us about that, because I know as soon as we say dentists are all about giving us the perfect smiles. So I see where that's coming, but if you could elaborate more about
More than a dentist, when I cross borders, I believe smile and the world smiles with you. So I'm a pediatric and preventive dentist practicing exclusively for more than a decade now. And we have a setup in Mumbai at the Children's Hospital, where we practice for kids age ranging from 0 to 18 years of age. Yeah. And more than being a pediatric and preventive dentist, my core specialty is myofunctional therapy. That is, I'm a certified myofunctional therapist from USA. And we work a lot on the abnormal parafunctional habits that includes the tongue thrusting, the mouth breathing, lip sucking, digit sucking, and this go unnoticed by the
I'm
parents.
sorry, you mentioned digit sucking. What is that?
Digit sucking is the finger sucking. Yeah. So this parafunctional habits, many a times they go unnoticed, and they won't call for a medical emergency at any point of time, but definitely it interferes with the normal growth and development of the jawbones, and this is what is important for the development of the jawbones.
Thank you for highlighting that, because as far as I know, most parents wouldn't think much of a thumb sucking child. They would say, "Bada ho jayega, sahi ho jayega." Nobody really goes for medical attention or
Exactly.
anything. So
Yeah.
you are saying that it is important to do that, and how would it benefit if they bring their child to you?
Okay, so before answering this, I would just brief you what pediatric dentistry is all about. So you would know when you have some tooth problem, you go to a dentist. But when your child has some tooth problem, you need to go to a pediatric dentist. And now when you go to a pediatric dentist, we have a wide range of treatment. The only advantage that we have over here is all the procedures are covered under one roof by a single person, and that includes right from fillings to extractions to root canals, crowns, and a lot many procedures. Now when we come down to preventive and interceptive orthodontics, this is something, it's a new field, but it is an age-old concept. Nowadays kids don't have time, they are more on gadgets, they don't play on the ground, they don't move around, they don't play on outdoor games, they're more hang to the indoor games, and in the process they're turning out to be mouth breathers over a period of time, and this mouth breathing hampers their overall growth. To explain you more better, if you see a child if you see a classroom with kids, you'll usually see kids sitting in this posture. So the humping of the back.
And I can see the mouth breathing. Right?
Yes, so the humping of the back, the lower jaw is drooled down, saliva on the pillow while sleeping in the night, short attention span, diarrhea, constipation, bedwetting, and there are not many features. It need not mean that the child should have all these features. A couple of combination of these features, and we identify that the child is a mouth breather, and once he is taken care of this mouth breathing, or maybe thumb sucking on the developing jawbones, it exerts abnormal pressure on the upper jawbones, and this results in a lot of problem, and then they land up with braces. So if you have to avoid braces, the best age for interceptive orthodontics is from 4 to 12 years of age. That is before the growth has completed, and with this you can enhance the beauty of the child. I usually tell parents that no child is ugly, every child is dear, and they are cute, they are beautiful, but you can make them their best, you can enhance their beauty.
I would want to go back to one thing you mentioned, bedwetting. Now, how is that related to a jaw disalignment? I'm curious.
It is nowhere related to jaw disalignment, but when you have mouth breathing, studies have shown that those individuals, those kids who are mouth breathing for a longer period of time, the chances of them having bedwetting at late stages of life, usually bedwetting ceases after 3 or 4 years of age, after you train the child. But those who are mouth breathers or those who have thumb sucking, they have some kind of social insecurity. That's where they land up with this problem, and for them the bedwetting usually extends till 8 or 9 years of age. I have had a child who could not go to a friend's place or cousin's place because she was embarrassed because of bedwetting. So at the age of no sleepover, so at the age of 11 she could not enjoy her school parties and stuff. So that is where we identified, we fixed her mouth breathing, and she's happy to do now.
Wow, and how long would something like this take?
Well, since this is prevention and interception, the early you intervene, the better the results. So if you intervene, for example, at 4 years of age, you can control it in 6 months. If you intervene at 8 years of age, you may take 12 months. It's basically a habit, and habit needs to be broken at an early age. Like smoking, if you have just started smoking a week, it's easy to cease, it's easy to break it. But over a period, habit is a tendency towards an act which has become, even though it's abnormal, but it has become an automatic part. So you have to break it not only at the conscious level, even at the subconscious level.
But I would like to highlight one part here, that this is a non-surgical treatment. So however long it takes, it makes absolute sense to try and do this because it's non-surgical, it's non-intrusive.
Absolutely. So the advantages we here have with this modality is it's a win-win situation. You take away the abnormal habit, obviously for aesthetic reasons. Secondly, the underlying symptoms are corrected. And we missed one major point with those kids who are mouth breathers. They don't not only have short attention span or constipation, they more importantly they have chronic or repeated episodes of cough and cold. And whether they wheeze at night, they snore at night, they hiss at night, they breathe heavy at night, they keep changing their positions at night, and they're not stable, so they don't have a sound sleep. And yes, and which affects the overall development. So the school attention comes down. Yeah, they are lethargic when they wake up early mornings. So this modality will never bring about a medical emergency wherein you have to rush to a doctor overnight. But by correcting this, you are improving the quality of life. You are enhancing the life. Yeah.
Perfect. That was a definite eye-opener for us because I would have never linked all of these things to a jaw realignment and how that would help the correction, bad habit. And what is your success rate? Does every child that come to you heals or is it sometimes that, well, we don't know what happened in this case?
Okay, to be very honest, this concept is patient compliant. It means you get compliance from the patient, you get compliance from the parent, you get 100% result. It's basically based on all or none phenomena. If you have to have results, you'll get 100% results. If the child is non-compliant, you cannot expect results because we are just guiding the growth. Now, in this modality, we teach the child posture, clip therapy, breathing exercises, lip exercises, so they have to do their homework. And only when this is done, the compliance is achieved. But whatever you say, even if they do it 50% of the expected, the results are going to be, just beyond expectations. Yeah.
So that gives us a lot of hope to definitely try this. All those parents out there who've been wondering what's wrong with their child, and I hope this is going to be some sort of reassurance.
So as you mentioned, this is a non-surgical approach. So the basic advantage you parents have is usually you guys panic when you have to go to the dentist. So you don't have to panic. All that has to be done is visit your pediatric dentist, identify the problem, identify the cause. Do not treat the symptoms, treat the root cause of the problem, and you're sorted because it's a win-win situation. You're not doing any surgical intervention. You're just taking care of the abnormal habit, and growth itself is the treatment to such problems.
Tell us a little bit about the hospital, Children's Hospital in Mumbai.
Yeah, so Children's Hospital in Mumbai is a 100-bedded super specialty hospital. With this, we are exclusive at this Kuwait Expo 2019 from the context that we cater to only pediatrics, and all the specialties right from pediatric surgery to pediatric dentistry, pediatricians, pediatric ophthalm, pediatric kidney specialist, nephrologist or the liver specialist, everything we cater to, but everything is under one roof.
Sounds like a perfect solution for all our children issues. Thank you so much for talking to us. If there's any message you'd like to give to your audience, here's your chance.
Well, I believe smile and the world smiles with you.
Oh, I love that. So let's all smile now then. It's now time to talk to the doctors from the Children's Hospital in Mumbai. Dr. Susan Fernandez, welcome to our show.
Hi, thank you for having us here.
Tell us a little bit about your role in the Children's Hospital in Mumbai.
The Children's Hospital Mumbai is a tertiary care hospital exclusively for pediatrics. We have all the super specialties in pediatrics under one roof. We specialize in pediatric surgery, pediatric dentistry, and we are associated with Innova Health Children Hospital and with Dr. Rahul over here.
Dr. Rahul.
Hi, thank you for inviting us. I'm a liver and liver transplant surgeon, and I'm associated with the Children's Hospital team. for the pediatric cases. In addition, I also do some work in adults, which is at an off-site center in Mumbai. We are here as part of the team that has come to this expo, this brilliantly organized expo, and we hope to gain a lot of experience, and we are going back with some very good memories and good associations. Thank you for having us.
So I have one quick question. You know, generally liver problems come with, at least that was my impression, in adults because of alcohol and things like that. Now this is a children's hospital and you're a liver surgeon. I'm a little confused. Do you have children that have liver issues, and is that genetic, or is that something that they are doing these days that's causing it?
Liver problems can occur right from the time a baby is born to any age. So while in the common man's view, alcohol is the only cause of liver problem, but that's not so. Alcohol, in fact, even in adults, comprises only 1 in every 4 of liver problems. There are several other problems that lead to liver diseases, which could be viruses. A fatty liver due to long-standing diabetes or being overweight is actually one of the predominant causes of liver damage. And that can occur even in children who are obese because of having fast foods and carbonated drinks. And that's why fatty liver and childhood obesity is a leading cause of liver disease, particularly in the preteens. And like I said, even in the neonatal period, as Dr. Susan will tell you, there are certain developmental anomalies as well as certain inborn errors of metabolism. That is, the liver lacks certain enzymes. So the metabolism is not good. It leads to deposition of some toxic chemicals in the liver and leads to liver damage. Also, in some children, you can have something known as acute liver failure, where the liver immediately fails due to either an infection or due to some medications, and these patients also sometimes require liver transplant.
I see. And speaking of carbonated drinks, we have to talk about how it affects the teeth, and that's where pediatric dentistry comes into practice. And we have Dr. Vivek with us, Jogani with us, and you are going to tell us about how is it that you help children with their dentist issues.
Yeah, so I'm a pediatric dentist and we practice exclusive pediatric dentistry at our setup. The exclusivity that we have over here is we have a general anesthesia facility, which is a world-class facility, and so those kids who cannot be taken up under local anesthesia on the chair, they are taken up for general anesthesia. And these kids include apprehensive kids, kids who are very young for their age group, for cooperation on the dental chair, or individuals, those who are with special healthcare needs. So we take them under general anesthesia, and we have an entire team of pediatricians and pediatric anesthetists who cover up right from before the surgery to the surgery and post-operative care. The advantage we have over here is that our OT is attached to an ICU as well. So we are totally covered during and post-procedure. Yeah.
And I wanted to highlight that even though there is a procedure that you can do under general anesthesia, that is definitely not what, it's not like, an alternative for parents, because it shouldn't be like, oh, we have this technique, so you can eat as many sweets as you want. No, that is not what we are recommending here. Please take care of your teeth. And if it be that your child is not cooperating on the dentist chair, then we have this solution at the Children's
Hospital, Mumbai. Yeah.
Thank you so much, all you doctors doing such a noble job treating our children here. Thank you for talking to us.
Thank you.
It's now time to talk to 2 other people who are associated with the Children's Hospital in Mumbai. Welcome to our show.
I'm Dr. Murthy, the Chief of Children's Heart Surgery in Innova Hospital, Hyderabad. And also I'm associated with Children's Hospital, Mumbai. And I perform heart surgeries on small babies, even 1 day old to their 9-year-old children with birth defects in the heart, and I perform heart surgeries even low birth weight, like 800 gram children successfully we have performed, and we do like closing holes in the heart to the complex multiple heart surgeries. As you know that children are very small babies and weighing sometimes lower than the 2 kilograms, and the heart is so small, and doing opening the heart and closing the holes and on a small babies, it's quite a task. And not only that, after surgery, that taking care of that children post-operatively is very important, and we have excellent results and world-class innovations in that. And we also innovated new surgical techniques in children's heart surgery, and those surgical techniques are published in international journals like prestigious American and European journals. And these surgical techniques go by my name, Dr. Murthy's Techniques. Yeah, and I'm so happy that coming to Kuwait, and also my wish is to help some of the children who are born with birth defects and can make them normal citizens in the country.
Doctor, it is such a pleasure to listen to you speak about this. And even as you speak about performing a surgery on a day-year-old, my hands are trembling just thinking about it. For you to be the surgeon, the dexterity you may have in your hand and the strength you have in your mind, I think speaks volumes about what you can do. And you mentioned the techniques are named after you, so I'm sure you must have put in a lot of effort and research and come up with some very interesting breakthroughs. I remember a couple of years ago it was very difficult to save a child who had a hole in the heart. I believe a lot has been achieved since then, and now it's much easier.
Yeah, we do surgeries not only from India, and also we perform surgery. A lot of children from African countries and Middle East and Bangladesh and Pakistan and other parts of the world. And see, when they come to us, they are really in a debilitating conditions, because there the facilities are not so good, and also diagnosis and the treatment could be a big problem for them. And see that the parents' anxiety to get these small kids, get this operation done. Once they do well after surgery, we see that full of satisfaction and what you call it, so much of gratitude for the child. So operating on a small baby and making him good child, and so we are giving 100 years of life to the baby. Yeah, and once you get this operation done, and maybe for a month or two they need medicines, and most of the children, they don't require any medication, and they will be like normal children. They can go to school, they can play with their peers. I don't know, they can...
It is a blessing for them, whatever you do. Thank you so much for talking to us. And about yourself.
Yeah, my name is Arif Parker. I belongs to Child Hospital and Satyam Hospital, Geo Medcare in Mumbai. We base in Middle East to get give services to Indian patient and abroad patient from Dammam, Saudi, Qatar and Dubai especially. We are going to start in Kuwait also. And especially for Indian community, we started in Geo Medcare, the government services like Prime Minister has been started. For free of cost, they are only has to register and avail the Rajiv Gandhi policy, Jandan policy from Prime Minister of India, Modi has been started. And that is we are going to give to our fellow Indians, and it is free of cost. Only they has to know how to get that one. That is we are helping the people on platform of from Geo Medcare, Kharghar, based on this one, from Ratnagiri and Konkan Belt. Yeah, thank you.
Thank you for talking to us and raising this awareness. May you be blessed for all the noble cause that you're doing.
This is also we are doing through the charity people. They help from Middle East also, and as in which hospital they require. That's why we associate with these multinational hospitals, and they help for needy people, especially for Konkan region, from Mumbai to Konkan up to Ratnagiri and Sindhudurga. So these people, we are helping new doctors to be joined with us, and we are given platform to Geo Medcare's Satyam Hospital services with Dr. Patankar Hospital. Yeah. Thank you. Thank you.
This is all we had for today. We have so much more, so stay tuned until next week when we cover more of this. From the team of Kuwait TV2, stay blessed and healthy.